Welcome to Healing at the Speed of Light. Every week we discuss how laser therapy is changing healthcare and how you can benefit. Now here is your host and founder of Laser Therapy Institute, Dr. Jason Rountree.
Okay. So that's the ground rules then. No sniffling into the microphone.
Nope.
Okay. I don't know why. Last 30 minutes, just a little bit sniffy.
Yeah.
It's cold though.
It is, and I'm sniffly because I just came from outside.
Yeah.
So
Yeah, that'll do it.
But,
Well, thank you for coming from outside into the
Yes.
warm inside where we could talk about our favorite subject,
yes,
laser therapy.
laser therapy.
Yes.
Love it.
Thanks for joining us today. This is our podcast titled Healing at the Speed of Light. This is our patient-focused podcast. Not that we don't let healthcare providers also listen to it, but
Right.
this is one where we try and approach things from a very patient-centric manner, meaning not that we're talking dumb or down-talking, but if you're a patient, you don't really care so much about the precise mechanics of how photobiomodulation therapy can apply to your cellular health. It's more of a, is this going to make me better? Am I going to be able to do more and,
Right.
and function better,
Just
feel better?
Just use common terms.
Yeah, I'm trying to use some common terms. And Kristi's going to help me with making sure I use common terms today. Kristi is a certified laser tech, very experienced, very much in the medical field here, but also a good stand-in for patients who might be listening because she can help me kind of stick with a little bit more familiar terms that make a lot more sense. Sometimes I get a little bit too nerdy, a little bit too carried away. But my name is Dr. Jason Rountree. I'm a chiropractor and a certified medical laser safety officer. We're here today to talk about neck pain, specifically neck pain from arthritis. And a little bit of a controversial title there, PT versus laser therapy.
Ooh.
Who comes out on top?
Ooh.
Yeah. So we're going to, as always, go back to the research for this one. And this study that we're going to be talking about today was published in Lasers in Medical Science in 2019.
Okay.
Pretty
So,
recent study.
Really
Pretty recent study. Yep. It's an Italian study. So there's, again, a few translation little things here, but I think I was able to work through those. Really a pretty neat study. One that we don't really see a lot of. We're kind of putting these two therapies head to head. So let's go ahead and dive in. Let's talk about what all this really means.
Okay.
So first of all, neck pain. Most people know what neck pain is. If you have neck pain, you definitely know what it is.
Exactly.
Yeah.
Exactly.
Now you can have acute neck pain, where maybe you get an injury and you have like a car accident. You have pain in the neck from soft tissue damage or a sprain strain type incident. In this case, we're talking about a term which is cervical spondylosis or arthritis. Kind of wear and tear, degenerative changes in the neck. That's something you can see on x-rays. And if you have spondylosis, it doesn't mean you always have pain, but in a lot of cases, this will be kind of a painful process. And spondylosis, meaning that wear and tear, or that arthritis process in the neck, means that we may not be able to necessarily fully resolve problems because there's some level of structural defect there. But for a lot of people with arthritis, they can get to the point where they suffer very rarely or very little if the situation's handled right.
So you can't reverse it, but you can maintain it and make it not get worse.
Right. At least when it comes to x-ray findings, we can't say that we're going to reverse that arthritis. But when it comes to how you function and how you feel and how healthy those tissues actually are, there are a lot of changes you can make there. And this paper actually highlights some of the really great changes, not only in people's day-to-day function with neck pain and arthritis pain, but also even their ranges of motion.
Nice.
Yeah. So this is really good. The title of the study is Comparison of High-Intensity Laser Therapy, or Photobiomodulation, as we know it, and Combination of Ultrasound Treatment and Transcutaneous Nerve Stimulation in Patients with Cervical Spondylosis, a randomized controlled trial. Let's translate that a little bit.
Please do.
So high-intensity laser therapy, which, as I already said, we also call it photobiomodulation now. That's
Right.
kind of the more proper term. That is not surgical laser. We're not damaging tissues.
No, non-invasive. It's very pleasant.
Yeah, it actually
Really?
is. Yeah, very pleasant. So laser therapy versus ultrasound treatment, not diagnostic ultrasound to create an image, but the therapeutic ultrasound that a lot of times physical therapists will use.
Okay.
And transcutaneous nerve stimulation, which is more commonly known as TENS. And this is that kind of electrical treatment where
they shock you
a little bit. You can put the pads on an area, and then you can dial it up, and it's supposed to help block pain signals, right? So they took 2 groups of patients. One group they did laser therapy and exercise.
Okay.
And the other group they did exercise with this therapeutic ultrasound and TENS modalities. Okay. And that's when we say laser versus PT, it's not really a fair thing, because really this is all physical therapy, okay? But when you think about physical therapy, most people think about
exercise, doing activity, guided activity.
Yeah.
Repetition.
Yeah. Activities. Stretching. Yep. Exercising. Maybe even strengthening. Exactly. And a lot of times there'll be some modalities that physical therapists use too, like TENS. So we'll put the pads on there, or electrical stimulation, heat and cold, things like that. And then maybe the therapeutic ultrasound. That's very, very common in both chiropractic and physical therapy practices. And the therapeutic ultrasound kind of warms the tissues and is supposed to help with pain reduction as well as healing to some degree. So I'll give you a little bit of the more technical there before we move on, just so we're all on the same page. So the ultrasound therapeutic modality is designed to warm muscles, tendons, and other tissue to improve blood flow and accelerate healing. Thermal effects, meaning warmth, aid in the pain relief, whereas non-thermal effects enhance cell repair effects of the inflammatory response. So trying, with this therapeutic ultrasound, trying to warm the tissues and enhance healing a little bit. And then TENS is quite different, though, because we're not warming the tissues. The TENS machine is supposed to actually interrupt the pain signals.
Okay.
So with a TENS unit, you're basically overwhelming the nerves so that they can't really carry pain signals. It's a very temporary response, but in a lot of cases can be really helpful for people. So, and then that's versus, like we said before, laser therapy. And laser therapy is supposed to induce photothermic and photochemical effects in the deep tissues, thus stimulating collagen production, increasing blood flow and cellular metabolism, and removing painful stimuli. So using light to trigger that positive response. So anyway, so there's 2 groups, right? One group's getting exercises and laser. The other group's getting exercises, the same exercises, plus ultrasound and TENS. So both groups get exercise, right? And then both groups get different modalities or treatments, as we call them. Right? And they treated these patients for about 6 weeks. So twice a week for 6 weeks, total of 12 visits. And then they did a follow-up a month after everything was done. And then they compared, okay, how is everybody doing on their pain levels, their function, and their range of motion, their mobility, before they started treatment versus a month after they stopped treatment.
So they stopped and then came back a month later.
Right.
Gotcha.
Because it's not just how you feel right then. It's also, do those effects really continue?
Lasting.
Yeah. That's an important part.
It is.
Yeah.
It is.
So they wanted to evaluate, like I said, range of motion, pain, and function, and that ties back into the cervical arthritis, the neck arthritis that we're talking about. Because when you go through that degenerative process in the neck, you get more and more stiff, you lose that range of motion, you get more pain generally as that arthritic process advances. Most people do. And then you also start to lose function with the neck. And when I keep saying function, but that really has to do with how it impacts your day-to-day. Does it keep you from going places, doing things, driving?
Right. I mean, if you don't have the mobility, you really can't function, and so then it just goes downhill from there, really.
Right. Yeah.
So.
And then generally, the less you move, the more pain you have. And the more pain you have, you don't really feel like doing things.
And then you get stiffer, and then something else could happen because you're not limber enough to... Yeah, it just compounds. Right.
And that's why it's important to address this, So a lot of times, just a little side tour, the treatments for that, a lot of times people go, oh, well, I must need surgery for that. And that's very much a last option to try. Most of the time, what's tried is a series of non-steroidal anti-inflammatory drugs like ibuprofen or pain relievers, maybe meloxicam as another non-steroidal, prescription strength pain reliever. But a lot of people get sent to PT
Okay.
Or chiropractic. They'll get sent to a non-invasive practitioner to try and work these tissues and improve pain, improve function without having to cut into somebody. Because once you do that, there's no going back. And unfortunately, the numbers on spinal surgery are still really bad. They've really not improved like at the rate that knee replacement success rates have.
Well, we did a podcast not too long ago on spinal surgeries, and
Oh, we did.
have to go back and listen to that one.
Go back and listen to that one if you're not sure. The outcomes are just really not very good.
Right.
There are some cases where you do need to have surgery, and
definitely.
you want a great surgeon. But in a lot of cases, even with degenerative changes, arthritis, disc herniations, things like that, surgery should really be the last thing you do if nothing else has worked.
Right.
So if you're going to go to PT, if you get sent to PT or to your chiropractor, what kind of things do a lot of people do? A lot of them do the exercises. They'll do some modalities like heat packs, cold packs, things like that. So this is a neat study to say, okay, what's really better? Is it better to send them to kind of a traditional PT, or should we be focused on laser? Now, exercises are still a piece of both of these, so really it is still PT versus PT, just two different styles.
With a different treatment to the actual tissue. Yeah.
Yep, different treatment to the tissues, because one is light energy, one is sound energy, and one is electrical energy. So three different. And we're gonna gang up on laser. We're gonna put the ultrasound and the TENS together and see if they can beat laser. And it turns out, what do you think? How do you think they did?
I'm still gonna go for. I'm gonna pull for laser.
Good move. I'll have you back next week too. Then.
Okay.
Yeah, that was your invite back, depending on what you said there.
I firmly believe it.
Yeah,
and it's nice to have research that backs that up. At least by the sounds of where you're headed with this.
Yes.
So.
Yes. The great news here, the really great news that we don't get to see in a lot of studies, is that both of these groups of patients did get a lot better.
Good.
So that is wonderful. So if you're going to PT and they're not doing laser, you don't have to stop going to PT. You can still get some good results. This is just interesting to see. Maybe if you didn't get the results you wanted out of kind of a traditional PT, maybe physical therapy with laser therapy added in might be better. I'm going to go ahead and just see if I can show you these graphs. This top graph is about pain. It says VAS. That's a visual analog scale. I'm not sure if you can see that really clearly or not, but it is the tall bars are where the patients were with pain when they started care, and then the short bars are how they did at the 4-week post-treatment follow-up. And so this guy right here, this is the traditional PT without laser therapy. This is the ultrasound plus the TENS plus the exercises, and they did quite well. They got quite a bit better. You can see that too, right?
Yeah.
However, the next, that guy right there, did I point to it right?
There you go.
There we go.
There you go.
That one right there, that is how well patients did with laser therapy plus exercises.
Nice.
Yeah. So
Nice.
better.
Yes.
Now, that's good. That's pain. And then pain's important. That's what most people come to us for, right?
Right.
It's pain.
Right.
But also then function.
Exactly.
Function's important too. And we saw the exact same idea here in function scores,
Nice.
where the group that got the laser therapy actually had better functional scores than the patients who got the ultrasound plus TENS. So I think that tells us right there that we're getting not only a little bit better results, but probably longer lasting results.
Well, because you said this was 4 weeks after the last treatment, and so then, it just shows that it is more long term, it is more lasting.
Right.
So.
Yeah. I'd love to see a 12-month follow-up on this and
Yes.
see how these people, were able to do. But I think that says a lot to say that, both of these approaches can work quite well. In this particular case, the laser did seem to outperform the other group.
What were the length of treatments each session?
That's a great question. So this was kind of an interesting thing. They used a high-intensity laser. They did, which is class 4 laser. All right, that's going to give you the faster treatments. This is a really kind of unusual device. It's not available here in the U.S. It's an Italian-made machine by the same company that actually makes the MLS laser as it's sold here in the United States. But again, this is not available here in the United States. But when I read it first, I thought, this is really interesting because it uses a 1064 nanometer wavelength, which is kind of on the far end of the therapeutic wavelengths. I promise I'll be done being nerdy in a second. But so a little bit of an unusual wavelength, but one that we know can work quite well. But the peak power was 3,000 watts.
That's going to scare some people when you say 3,000 watts.
3,000 watts.
Yeah.
So, but you know me, I always like to talk average power.
Right.
Because average power is what's important on these. If you want to know more about peak versus average power, shoot us an email, info@lasertherapyinstitute.org. I'll go into it like crazy, but essentially, this is a 10.5 watt laser at max power.
Yeah.
That's all it's putting out. Very high peak powers, but because of the way that it's pulsed, the power ends up being 10.5 watts, which is very average.
Comfortable, not burning, not,
Exactly.
we're talking very non-invasive again.
Yes.
So, not to be scared by that 10,000.
Right, yeah. So when they were doing the laser, they ended up taking about 30 minutes to apply a little more than 2,000 joules. And they did this in a whole, like, different stages of treating it, which is pretty unusual. But at this point, we have lasers right here, right now, that can deliver 2,000 joules in about 2 minutes.
Right.
So,
right.
with no problem. So it can be very, very fast, or it can be a little bit longer, like this treatment, like I said, about 30 minutes. I think it's important to note they did treat not just the neck, but they treated the interscapular area between the shoulders, kind of below the neck. They also treated the trapezius muscles, these guys that come out onto the shoulders, and the sternocleidomastoid muscles, the SCMs, and those are the ones up front that go from right below your ear right down to your collarbone.
Yep.
So those are all important muscles to treat, and that's something to realize. This isn't just treating the spot that hurts. A lot of times patients go, oh, it hurts right here. That's fine.
Well, you need it balanced.
You need balance.
You need balance and strength, and that's, again, the PT and the exercises. You're strengthening all those muscles, so they, at least that's my experience, where you're trying to get the whole rather than just the one area.
Yep, exactly. So. Yeah, no, and that's important. It's the neck is codependent. Each level, each part of the neck is codependent on the other parts, and so treating the neck as a whole sometimes means treating areas that don't necessarily hurt, or going out into the full length of muscles, going down into the mid back even may be an important part. Just like when you're doing exercises, sometimes you need to stretch some muscles, sometimes you need to exercise other muscles. You're looking at the picture as a whole, though.
Right.
So,
interesting.
30 minutes worth of laser, but again, that can be done very rapidly, depending on the equipment itself and the technique of applying it. And then the exercises were worked on with the patients to the point where they could take them home and continue them, which is an important step, I think, to give people the tools that they can use there in the future to kind of help maintain their strength and stretch appropriately. Now, we didn't mention range of motion. Range of motion did improve also better with laser than it did with the other ultrasound and TENS combination. But everybody got some improved range of motion, just stronger results with laser therapy. So not only improved pain, improved day-to-day function, but also improved range of motion. So if you're driving a car, it's important to be able to look at that other lane.
Yep. That's important. So that's amazing. I mean, it really isn't amazing, because we know how well light therapy works.
We do.
And
now, this is the point where people go, okay, I understand that it works, but like how? Like what is happening when you shine light on the skin, right? Okay, if you don't care, this is the time to be done. I'm just going to read a couple of quotes, though. If you want to know what really happens in the tissues when you get infrared light on the skin, it's not just going onto the skin, it's going deep. And so this is a good point to go ahead and read some of what they said here. Laser therapy is supposed to have anti-inflammatory, analgesic, anti-edema, and reparative effects. The analgesic effect is based on a direct action on nerve structures and its ability to slow the transmission of the pain stimulus, and to increase the production of morphine mimetic substances in the body. Morphine mimetic meaning morphine-like substances in the body. Because your body has its own ways of calming down pain signals, right? So part of this is helping the nerves to control those pain signals and produce these anti-pain signaling molecules.
So helping the body do what it's designed to do.
Exactly.
That it's not doing.
Yep.
So
laser therapy acts by altering the release of histamine and bradykinin from injured tissues and of substance P from the peripheral nociceptors, which are pain nerves, thus increasing the pain threshold. Finally, pain is inhibited centrally by an increase in the secretion of endogenous opioids and the reduction of inflammation by the stimulation of increased neutrophil and macrophage activity.
That's a lot.
Mm-hmm. Like I said, if you don't you don't have to stick with me on this one, but if you're one of those that really wants to know exactly how this works, what's really happening, this is it. We're talking about cellular signaling, cellular effects that are the body's, like you said, natural mechanisms, but we're stimulating them more.
Mm-hmm.
It also says that laser therapy decreases interleukin-1 and C-reactive protein. C-reactive protein is one of the markers you'll find on blood work for inflammation, CRP. It also enhances lymphocyte response and superoxide dismutase levels, thus determining its anti-inflammatory response and its ability to accelerate tissue healing. It also stimulates mitochondria with an active role of cytochrome C oxidase, which increases ATP synthesis or energy synthesis in the cell, and increased proton gradient, which causes more movement of components across cell membranes, and activation of secondary messengers such as CAMP and calcium ion pumps. Okay. So that's the end of that.
Okay.
But if you want to know what's going on there, that's all very microcellular focused. That's exactly what we're trying to do, though. We're trying to get down to the cellular level to create an environment that is stimulatory to healing and controlling pain, not just one or the other.
Increasing that activity so that it works.
Right.
Yeah.
And we know all these processes become slower and less efficient as we age. And osteoarthritis is typically associated with aging. So this is really great for an arthritic degenerative condition because it helps get the body back to where it can do some of the things it should be able to do on its own.
Well, and if you can catch it early or earlier, I mean, there's really, I don't know if there's a too late. There's something you can do at least to maintain. But if you can catch it early, you can really have an impact and decrease your pain, increase your mobility with the strengthening, with the exercise.
Yeah, absolutely.
So
and that was one of my takeaways.
It's a complete package.
That's good because it's important to note here, this wasn't just standalone laser versus ultrasound and TENS. They included exercise for both these groups, and that's a big part of probably a big part of why both these groups succeeded in care and got better is because they were able to do the exercise plan too, and guided exercise plan. You know, somebody set something up for you and they know what they're doing. A physical therapist, a chiropractor, an occupational therapist. You know, I don't leave anybody out here. Personal trainer even. If somebody sets you up for success for exercise, you can see good effects.
And it's not necessarily hours in the gym. It's probably simple strengthening exercises that, like you said earlier, you can learn and take home and just do at home. Yeah. You don't have to go anywhere always to get it done. Right.
When we're setting up people for exercise, how long does it take them to do that stuff at home, do you think?
Minutes.
Yeah.
Minutes. It's even before you get out of bed on some of them, but it's just simple day-to-day strengthening and helping your own mobility. So. Yep.
Good. So we know laser works. We know laser may work even better than some of the traditional PT modalities. It's worth a shot for most people with neck arthritis pain.
It's worth a shot. Why not?
Yep. So. Just be aware, if you're going to get laser, a lot of times there's things that need to go along with it or that can make it more beneficial, like soft tissue mobilization or some basically massage type action with the tissues, or exercise or stretching. There's things that can really enhance the body's response. So it's not just going in and getting laser done. Sometimes you need more than just that, but the results can be really, really good.
Yeah. Of course.
Awesome.
Nice.
Thank you for joining me today.
You bet. Thank you.
See you in a couple weeks.
Glad I can come back.
Me too.
Subscribe to this weekly podcast for more great information. Find a certified laser therapy clinic near you at lasertherapyinstitute.org. If you're a healthcare provider, check out our practitioner-focused Laser Therapy Institute podcast. Thanks for listening.